to Shri Ram Medical College. Today we will explore the role of a physiotherapist, what to expect during your appointments. Visiting a physiotherapist for the first time can induce some anxiety. You may have heard horror stories about massages gone wrong, where the therapist made the client even more uncomfortable by applying unnecessary pressure or causing further injury. The doctors and nurses will sit down with you and ask the standard questions about your medical history and the injuries. We need to know the specifics of your injury and what led up to it. Recognizing the factors that aggravate your discomfort and those that provide relief can be quite useful. The physiotherapist will ask you a series of questions to zero in on the cause of your pain and formulate a treatment plan accordingly. Your physiotherapist may then evaluate your reflexes, senses, strength, range of motion, ligament and joint stability, sensitivity, and mobility. Inflammation examination by palpation, to detect tender areas in bones, joints, or tendons, finding out which bones, joints, or tendons are sore to the touch. Your physical therapist can better treat your pain if you undergo these examinations to determine its source. Wearing shorts for a sore knee or a singlet for a strained shoulder will help your therapist focus on the area of your body that requires attention during your session. As examples, it can be strange to sleep in someone else's bed, but you can trust that we will do everything in our power to make you feel at peace. Please bear in mind that we may ask you to perform some maneuvers or assume some unusual positions in order to make an accurate evaluation. We promise not to push you past your comfort level, and if we do, you can count on us to stop or at least let you know how much it hurts. We utilize a combination of physical treatment, such as massage or mobilization, and exercise to help our patients heal. We're aware that massages have a bad rap, but rest assured that we'll do all in our ability to put you at ease during your session. In order to maintain the highest standards, physiotherapists regularly assess the effectiveness of their treatments. Consult a physical therapist to find out what kinds of exercises will benefit you the best. Exercise physiology is a major focus of a physiotherapist's education, the science of exercise. A physiotherapist can analyze your ailment, diagnose it, and prescribe activities to enhance your health and fitness. Heat therapy has been shown to alleviate pain, relax stiff muscles, and increase mobility when administered to joints, muscles, tendons, and scar tissue. Applying ice or cold can be quite helpful at lowering swelling and pain when inflammation is still an issue, such as after a recent injury. There is some evidence that alternating warm and cold applications can help reduce pain and edema due to chronic inflammation. High-frequency electrical stimulation, or interferential current, IFC, has been shown to reduce inflammation and edema, two of the main obstacles to a speedy recovery. Neuromuscular electrical stimulation, NMS, is used to treat muscle spasm, atrophy, and edema and re-educate and reactivate inactive muscles. Pain can be alleviated temporarily and permanently with the help of transcutaneous electrical nerve stimulation, TENS, devices. Muscle imbalances can be remedied with the aid of biofeedback, which is a device that analyzes electrical activity from your muscles and provides feedback on your performance. Therapeutic ultrasound, US, can help with edema, discomfort, and muscular spasms by using high-frequency sound waves to go through gel or water and into deeper tissues, where the issue resides, scar. The use of ultrasound to penetrate topical drugs, known as phonophoresis, has been shown to be effective in reducing pain and inflammation. Stretching is a common form of physical activity that helps to lengthen and loosen muscles and improve mobility. Your physical therapist may employ a wide array of stretching techniques. Static stretching, dynamic stretching, and passive range of motion (PNF) stretching are all examples of common stretching methods. Your physical therapist will devise a program of specific exercises for you to follow in order to speed up your healing process or improve your fitness level. The clinic may assign you some gym work to complete there, or they may recommend a home fitness regimen that will allow you to work out at your own pace and in the comfort of your own space. There may likely be follow-up work for you to do after your initial consultation. We place a premium on making sure you have access to the resources you need to get better, so if we think assigning you a task will hasten your recovery, you can count on us to do so. Any action, from maintaining a log of your symptoms over the following week to doing a set of simple exercises or going for a 15-minute stroll, is acceptable. As our session comes to a close, we will examine the steps you should take to go forward toward achieving your objectives. It stands to reason that you should prioritize doing everything it takes to feel well, resume your regular activities, build your strength, and get back to enjoying life. The best way to make progress in your therapy and get back to full health quickly is to set up our next meeting. Rehab regimens include 2 weeks of at-home workouts, 2 weeks of moderate jogging, and 4 weeks of training, e.g. 25 single-leg calf raises, or 10 hops without pain. Reduced neural impingement in the spine means reduced back pain. The therapist may utilize manual traction, in which the patient lies face down on a table, or mechanical traction, in which a machine gently pulls the patient. Pain is not a normal sensation during exercise. Even though you may feel pain while performing specific tasks, you should be able to relax and feel better once you're done. Your physiotherapist needs to know whether you're experiencing new or growing discomfort from your workouts to evaluate your progress and adapt your program. Muscles atrophy in both extremes of use. When these muscles are weak, accidents are more likely to happen, and injuries take longer to heal. Even if you regularly exercise your stability muscles, they may stay weak. Injured people often abuse helpful aids, which can exacerbate their condition. In order to prevent further injury, your physical therapist can recommend a series of targeted exercises to strengthen your core. Your physical therapist will also provide guidance on how to increase the level of difficulty in your exercises while you are healing from an injury. When formulating your recuperation plan, it is advised that you consult with an exercise specialist such as a physiotherapist. Join Shri-Ram Medical College's Bachelor of Vocation in Physiotherapy and take the first step toward a successful career in physiotherapy. We are here to assist you in launching your career as a physiotherapist. Call us at 9968193009 for more information about our program or to submit an application right away. Shri-Ram Medical College, nurturing next generation of healthcare leaders, and offers all paramedical courses at competitive fee and helps in 100% placement assistance. Admission open. For more information, please visit our website ShriRamCollege.com and like, share, subscribe our YouTube channel Shri Ram Medical College. Good luck, goodbye.